You saw in that report 34% of those who've been through COVID are experiencing mental health issues. And even if you haven't been through the infection itself, just seeing the death and devastation around you is taking a huge mental toll on every one of us. Some of us are cognizant of the impact this is having on our mental health. Some don't realize it, and some are just sinking without even knowing that they're sinking into a hole. To talk about how best to deal with the mental health issues that the COVID pandemic has thrown up, I'm joined on this broadcast by a very distinguished panel. I want to welcome first Dr. Vikram Patel, Professor of Global Health at the Harvard Business at the Harvard Medical School. We have Dr. Sameer Parekh, psychiatrist and director of the Department of Mental Health and Behavioral Sciences, Fortis Healthcare. We have Dr. Amit Sen, child and adolescent psychiatrist, and Dr. Bhavna Burmi, child and clinical psychologist. I want to go across to Dr. Patel first. Can you explain what you're picking up? First, let's just talk about the problem itself and everything that you're seeing around you, hearing people who are talking to you. Explain, Professor Patel, what is it that you're picking up about the kind of impact the second round of COVID infections is having on the mental health of Indians?
Well, thanks first of all for taking up this really important subject at this extremely harrowing time in India. I think it would be fair to say that what India is experiencing on a scale probably never seen before is a giant humanitarian crisis. And I think we can really refer to the large body of evidence from other humanitarian crises to understand what's happening in India at the moment. And I'd really say there are two broad issues that we should consider. What's happening at the level of the entire population, the sweeping anxiety and fear, for example, of contracting the infection. And more importantly, that is twinned with the sense of, well, the usual comfort we have on people we trust collapsing around us. And then you have a specific subgroups in this population who have disproportionately been affected by the pandemic, and I'm sure we'll talk about them, but just to flag them up, first of all, we must acknowledge the unique needs of people who survived COVID, particularly those who have had acute respiratory problems or had essentially been put on a ventilator. The second is young people who have been blocked out of their schools for more than a year now. And the third is women who have found themselves in a very patriarchal society, locked into their homes, not only having to deal with work, but also with their kids and with other domestic responsibilities. And finally, let us also not forget people who had pre-existing mental health problems, because this is a group that we now know from evidence in other parts of the world are 2 to 3 times more likely to die when they have COVID, just in the same way that we see with other chronic diseases.